Good morning, everyone, and welcome to Summit 2019, Queering Healthcare Access and Accessibility.
Bonjour tout le monde, c'est bon de vous voir. Nous apprécions votre présence au Summit 2019, mettre le cuir dans l'accès aux soins de santé et l'accessibilité. Thank you for spending your Halloween with us. We know that for most of us, this is a national holiday, so we appreciate that. And we hope that the next couple of days will be weekendly engaging and hauntingly fruitful.
On behalf of the Community-Based Research Center, I want to acknowledge that we are on the unceded Coast Salish territories of the Musqueam, Squamish, and Tsleil-Waututh people. This is important because the impacts of colonialism has shaped our views on gender and sexual identities. And the homophobia and transphobia we experience today are largely rooted in settler colonialism.
Le colonialisme a également contribué au taux de VIH plus élevé que prévu présent dans les communautés autochtones.
So CBRC will continue our work in step with our commitment to truth and reconciliation, and I hope all of us will keep these things in mind as we participate in the summit. My name is Darren Ho. I'm the BC Regional Manager for CBRC.
My name is Patino-Gomez, and I'm the Digital Marketing Manager for CBRC. Cette année, nous célébrons à la fois le 15e anniversaire du Summit et le 20e anniversaire du CBRC.
This is an exciting year for our organization. Not only is this the Summit's 15th year anniversary, but 2019 is also CBRC's 20th anniversary. Thank you. And so there is a lot to look back and to be proud of. For instance, this year's summit has the largest number of attendees on record. Yeah. And after 10 years at SFU Harbor Center, we've now moved to this location, Coast Coast Harbor Hotel.
This is a change. This change is a testament of the growth in our community and your support. So whether this is your first time at the summit or you've been with us since the SFU days, or perhaps even earlier at UBC, we want to thank you. By coming together like this, we're building the capacity to make real change for people, and it's working.
Since last year's summit, the city of St. Albert in Alberta voted to ban conversion therapy, reminding us that this is still an issue federally, provincially, and nationally.
La Société canadienne du sang, Canadian Blood Services, et EMA Québec ont actualisé leurs politiques d'exclusion du don de sang pour les hommes ayant des rapports sexuels avec des hommes et ont réduit la période d'attente de 1 an à 3 mois.
In BC, we've enrolled over 5,000 participants onto PrEP since the province started covering it, and that number continues to grow each month.
Earlier this year, CBRC, along with dozens of community, public health, and academic experts across Canada, most of them are here, testified to members of the Parliament on the health and social inequalities faced by diverse queer and trans communities, including high rates of HIV and STIs, mental health issues, problematic substance use, and suicide. In June, we were thrilled to see this work inform the Standing Committee on Health's historic report that included 23 recommendations for the federal government to improve the health of LGBTQI Canadians.
Yes. So, we've done a lot together, but as you know, there's still so much more to do. And that's what these next 2 days and the connections we make here are all about, building on the progress we've made and continuing to bring positive change to our communities. So we'd like to thank some people without whom we wouldn't be able to have the summit.
To our programming committee, who review all abstracts and make sure the program built this year is the best that we can. So thank you so much.
To our community partners who continue to support the summit in so many ways, thank you. Thank you to Max Ottawa, Health Initiative for Men in Vancouver, Réseau in Montreal, ACT in Toronto, Men's Health Initiative in the Interior, Youth Co in Vancouver, and Edmonton's Men's Health Collective.
À notre comité de programmation et à nos partenaires communautaires, merci pour toute l'aide que vous nous apportez afin de faire de ces sommets les meilleurs possibles. None of this will be possible without the generous support of our sponsors who continue to believe in the summit and invest in our health. So thank you to the Public Health Agency of Canada and to the BC Ministry of Health and the province of BC.
We also want to acknowledge this year's presenting sponsor, ViiV Healthcare. ViiV Healthcare is a pharmaceutical company that is 100% dedicated to HIV and AIDS research and treatment, and to supporting people living with HIV and AIDS across Canada. Thank you, ViiV.
And lastly, we would like to extend a very special thanks to Rick Marchand and Terry Trussell. Thank you for your guidance, support, and leadership over the last 20 years. We literally would have been here without you.
And so with that, to help us start the summit, I'd like to welcome CBRC's Executive Director, Jody Jollimore.
Thanks, guys. Thank you, Darren and Jose. My name is Jody Jollimore, and I'm the Executive Director. I have the pleasure of being the Executive Director of Community-Based Research Center. I want to echo Darren and Jose's welcome to the 15th Annual Summit. When I got involved in 2005, we were still meeting in the basement of UBC Robson, and we've come a long way together. I want to start by thanking and welcoming the folks on the stage with me, our Summit elders, Florence James and Dr. Lee Brown. We're honored to have them with us this year. Unfortunately, Summit regular and crowd favorite, Bill White, was unable to join us, but we want to thank him for his continued support of CBRC. Bill will be joining us in a few weeks to start our Elder Circle, which will help inform our work with Indigenous and Two-Spirit people. I'm so happy to have my sister in reconciliation here, Rocky James, back for a 4th year. And excited for you to meet Glenn Tssessaze, CBRC's new Indigenous and Two-Spirit Health Promotion Lead. Just wondering if I have any slides yet. So how did we get here? Well, 4 years ago I met with Rocky James and I asked him why he had stopped attending the summit. He told me that there wasn't anything for Indigenous, queer, and Two-Spirit people, and that if CBRC wanted to engage Indigenous people, we were going to need to make some changes. Together, we started on a journey of truth and reconciliation that has resulted in a strong professional partnership with the Metro Vancouver Aboriginal Executive Council, a friendship between Rocky and myself, and a commitment by our organization to do things differently. No, we're not there. Part of doing things differently means being accountable to our commitments. You see, it's not enough to simply support things like truth and reconciliation recommendations, the calls to justice from the Missing and Murdered Women Inquiry. We must respond to these recommendations and calls. We must find ways to actualize them in our work. And that's not easy. It takes time to build relationships, it takes time to decolonize, and it takes time to change. I'm proud of what we've accomplished over these past 4 years. In particular, I'm proud of what we've accomplished over the past year. Our board has made Indigenous Truth and Reconciliation one of 5 strategic directions for the organization. We've created space at our board meetings where we'll be accountable to these 5 directions, and we will report on them on a regular basis. We've increased Indigenous participation at Summit by continuing to have Indigenous representation on the programming committee, by continuing to invite elders to the Summit, by inviting an Indigenous plenary speaker, Dr. James McCocus, and of course this session on truth and reconciliation and the creation of a Two-Spirit Longhouse. We recruited an oversampling of Indigenous and Two-Spirit people in the Sex Now 2018 survey, or as our colleague Harlan Pruden said to me, it's not an oversampling, Jody, it's just doing good research. We hope to continue that trend in the 2019 online survey. We supported the development of Healing Inner Voices, an Indigenous-led film project by Martin Morberg. We supported the development of a PrEP info campaign for Indigenous people. We partnered with the First Nations Health Authority and MVAC to apply for funding to hire an Indigenous health and promotion lead. And we also hired a Truth and Reconciliation consultant, Rocky James. These 2 paid positions are creating space at CBRC for important conversations and continued and increased efforts to change the way we work. We're hoping to make these permanent positions at the organization. Recently, our partners at MVAC invited us to attend a presentation by a Maori professor from New Zealand who gave a very inspiring talk about the importance of using an asset-based approach to Indigenous work. And an asset-based approach is something we're quite familiar with in GBMSM work. And one of the slides that stuck with me was his opening slide, and he says, we have to stop asking what's the matter with Indigenous people, and we need to start asking what matters to Indigenous people. And it stuck with me. It's a simple idea, but a very powerful one, and it's important for those of us working in community-based research, in programming, and in policy making to consider. It has applications for how we develop our surveys, how we deliver our KTE, and how we advocate for policy change. So I'd like to ask Glenn Tssessaze, the CBRC Indigenous and Two-Spirit Health Promotion Lead, to introduce himself and the video montage we created.
Thank you, Jody. My name is Glenn Tssessaze. I'm Denisumshine from northern Manitoba, so I'm also a visitor to this area. I identify as an Indigenous gay man and a Two-Spirit. As mentioned by Jody, I am the Indigenous and Two-Spirit Health Promotion Lead at CRBC. I'm the first person to have this position as it is newly created. The following videos are some of the generous souls who have agreed to participate in telling us what matters to them. Now, of course, this is just a small sample of some people we know, by no means and it's exhaustive, but we are hoping that it might give you some ideas to carry forward in the next few days. Thank you. Think of what matters to Indigenous people when you are presenting, or asking questions. Show video, please. Thank you to everyone who participated. In addition to collecting stories from our partners, my role includes compiling a database of individuals and organizations to network with Indigenous, gay, bisexual, transgendered, and two-spirit, participating in the Urban Indigenous Equity Framework Advisory Committee meeting, and the Health Initiatives for Men's Trans, Non-Binary, and Two-Spirit Focus Group, and the Health Equity Collaborative. Continuing to book meetings and other important stakeholders across the province, promoting the Sex Now survey, the summit, and the PrEP resource for Indigenous people, developing innovative testing and interventions for Indigenous people, organizing and supporting Two-Spirit consultations and gatherings. Part of this role is to bring the wisdom and knowledge of elders, so I'm grateful for receiving coaching in regards to this new role from the following Two-Spirit community members: Harlan Pruden, Kevin Barlow, Rocky James, Dion Thrivage, Dallas Putlis, Rodney Little Mustache, Sekani Dekalth.
Thanks, Glenn.